Welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County. Joining me today is Brittany Vaughn and Anita Wilson with Helping Hands. Thank you, ladies, for being here.
Thank you for having us.
Yes. Brittany, we're here to talk about volunteers.
Yes.
Talk about why we talk about volunteers in April.
Because April is Volunteer Appreciation Month. And so this is a wonderful time to acknowledge all the work that people in the community do in sharing their time, their talents with our different nonprofit organizations in particular, which is why we're here, because that includes us in that group with Helping Hands. So this is a great time to highlight the work that volunteers do and to really sort of put a spotlight on that at this time.
Anita, as a volunteer, can you just give us a big picture of some of the things you do?
Well, when I first started at Helping Hands 15 years ago, the first thing they asked me to do was to fill prescriptions. And I looked at them and I said, "You've got to be kidding me." And they said, "You know how to read and you know how to count," because we didn't even have the counting machines then. And so I did that at first. And then they figured out that I could do that, but they moved me to receiving in medications that come in for individual patients. We have to write it down, and then we have to put their names on the medicine and put it in their basket. And a friend of mine had been doing the next part, which was entering it into the computer, so we would know when to reorder. And unfortunately, she moved out of town, so they moved me into that position, and I've been doing that job, and I'm the only one that does that job. As a volunteer,
and we are very grateful for her.
At there, and I have quite a good system and can find lots of not lots of errors, but if there's an error that pops up, like somebody gets medication enough for the next 3 years, that's not good.
No.
So I can let them know, and I can fill in doing other jobs. I can still fill prescriptions or receive the medications in manually, but those are my main jobs. And I go just about, if I'm in town, I go every week.
Yes.
So,
How long, you say you go every week, how long do you work during that week?
it depends on how much medication. Like today, we had very little, so I finished in less than 30 minutes. Some days I'm there 2.5 hours. So it just depends on how much medication has come in that week. So,
and you said something that struck me. When you started 15 years ago, you filled prescriptions, and I'm like, oh my.
Yeah.
Because we have talked, and you were talking about being a teacher.
right.
And I was like, that, I knew that probably wasn't your training.
No, but see, a pharmacist comes behind us and double checks. We put it in a basket with the bottle that we took the medication out of, so they do a double check. And after I did it once, it was okay.
And it sounds, when you say you can read and you can count.
Right.
Yeah.
Yeah. So it's something that just about anybody could do. And I do fill in doing that from time to time. If I'm there and somebody can't be there, I'll, it's not that I can't do it anymore, but.
And I've seen, because Brittany gave us a tour last month when we talked, and I've seen your pharmacy and the organization in that, and I find that amazing. I don't know if that's a volunteer thing, a staff thing, or a combination.
I would say that it's a combination. We have a wonderful pharmacy manager who keeps things ship-shape. And so our pharmacy at Helping Hands is fully licensed, and we operate under the supervision of our pharmacists in charge. So just like Anita was saying, all the prescriptions that go out of the pharmacy are checked by our pharmacist, but we would not be able to fill those prescriptions and to do all that work and keep the space organized and neat and ready for patients without the support of those volunteers. So it's pretty amazing the output that happens. Last year, our pharmacy prescribed about 13,000 prescriptions for our patients, or dispensed 13,000 prescriptions for our patients. Almost $4 million worth of medication moved out of that pharmacy last year.
That's amazing.
And went to the patients who received it for free. So it's pretty great.
Yeah, it is pretty wonderful. And I've actually seen names of my former students that are getting help, and that pleases me, because I basically know the backgrounds they came from, and they're getting doing something for themselves to keep themselves healthy by coming. So that makes me happy.
What drew you to Helping Hands? Because there are millions of places you can volunteer. So why Helping Hands?
There was a lady by the name of Connie Vermillion, who has since passed, that was a paid employee at Helping Hands that I went to church with. And at that point, most of the services were at night, and that didn't work for me. You know, I had a child at home, my husband was at home, and so she told me, she said, okay, we've got a job for you during the day now, so you can come volunteer. And I said, well, okay, I'll come volunteer. And I joke and tell them that the only person that I know that's been working there longer than me is Deborah Filial. So
She came with the building.
yeah, she came with the building. So so I've been happy to do it. I still did some substituting, and one day I told the 8th grade class, you know, that I was. They said, "Are you going to be here tomorrow?" And I said, "No, tomorrow's my day to volunteer at Helping Hands." And a boy looked at me and he said, "You mean you go there and they don't pay you?" I said, "No, they don't pay me." I said, "I do it because I want to." He said, "Well, I would never do that." And a young girl said, "Well, I think that's one of the nicest things I've ever heard." Oh. So, you know, I can, with that, I can help other people see that volunteering is important too. And I'm a volunteer. I volunteer here at the Mitford Museum in Hudson. I do work at Helping Hands and just other organizations. And, you know, while I am able and healthy to give back, that's what I want to do.
That is the servant attitude that, you know, every organization is looking for. And between Helping Hands and the Mitford Museum, you have quite a variety.
Oh, yeah.
Yes.
So that keeps life interesting, I
bet.
bet.
It does. Yeah, it's nice. And the other volunteer I think do is at Lenore Ryan University. They have a listening post, which is just a sounding board for students. If they need somebody to talk to, not to tell them what to do, but just to talk to, I do that once a month. So
That's awesome.
Yeah.
It's a wonderful program.
You know, the more you do, the more people you meet, the more fun you have.
Brittany, tell us about your need for volunteers.
So we are always actively open to recruiting new volunteers. And primarily our volunteers help us with, you know, just like the work that Anita does, support in our pharmacy, either filling prescriptions or helping out with organization or helping with some of that workflow process that happens between the ordering of the medication and when it gets into the patient's hands. So that's a huge part of what our volunteer corps does. We also have administrative tasks. That's something that's a need right now. We are in need of some more administrative volunteers to support our staff, because that's something we were talking about earlier, is that I don't know any nonprofits that are staffed to not need the support of volunteers. And so Helping Hands has a small staff. We have 9 staff members, you know, to support our, you know, the 1,200 patients that we serve in any given years. So it's really important for us to have that kind of support. We also have had volunteers to help us with specific roles. That they come to us with professional skills, such as we have some volunteer interpreters who help us with patients who English is not their first language. We've had volunteer you know, nurses or medical assistants or folks who help support our patient visits. And then for a long time, Helping Hands had a large array of volunteer providers who actually came and provided the clinical care for our patients. Right now, we have 2 wonderful paid providers who see patients in the clinic, but there is opportunity if we have, you know, folks in the community who want to come and volunteer their professional skills. That's something that can do nothing but benefit our patients. So there are lots of different opportunities. We also are often in need of volunteer groups to come and help us with projects, because again, we're a pretty small staff, and you know, I mean, and it takes keep and work and maintenance to keep our clinic clean and safe and a great place for our patients to come. So those kinds of things are really helpful as well.
How do people volunteer? What's the process?
The easiest thing to do is to either call the clinic or to email Deborah Filial, who is our assistant director and coordinates our volunteer program, and just start the conversation there. We have a simple application process, and then some on-the-job training for the role that you're going to play, and you're ready to go.
So really, it's a phone call.
Yes, that's really all it takes. So.
Anita, when people ask you, like the children, but when people ask you about volunteering at Helping Hands, what do you tell them?
I tell them basically exactly what Brittany has said, that it's an opportunity for people who kind of fall between the cracks to get the medical help that they need. Yeah. And as a mom of a daughter that was diagnosed with type 1 diabetes when she was 33 months old, and she's now 33, I know how important healthcare can be. And several of my students who have also been diagnosed with type 1, I have seen them come to the clinic to get their insulin, and that kind of makes me tear up, making sure that they are getting the care that they need, that that I knew my daughter was going to get, but that they get. And I just let people know that sometimes people just need a little bit of help. And part of my job is, when medications come in, that name might not be in the system anymore. So I always, ask. I said, okay, I can't find this patient. And they say, oh yeah, they got insurance, which meant that their job improved,
right.
or it may be that they got Medicare or Medicaid, and but just knowing that people are getting the help that they need, even though it's not my job to do it, but it's my job to be a helper. And I guess as a teacher, I've always done that. I've always tried to be a help to my students, and so I just want people to see that there's a need and that there are people like me that can help.
Brittany, in case somebody doesn't know, and Anita led perfectly into this, tell us the mission of Helping Hands.
So the mission of Helping Hands is to provide free health care and pharmacy services for folks who are uninsured and don't have access for insurance and who are low income. So we are a safety net, and hopefully an opportunity for those folks to improve their health, to engage in their wellness, and to have a medical home. So that's our goal. So our patients come to us just like you would go to any other doctor's office. We enroll our patients. We get their medical history. We get their medical records. We have to confirm eligibility. So there's there's a financial application piece that's involved there. But then they come to us. We're their medical home. We're their primary care provider. We also are able to provide urgent care visits for our patients. We're able to help them with chronic disease management, education about their illness, and then of course access to their medications for free. So both their visits with the physician or with their primary care provider and their medications that they're able to receive through our pharmacy are free.
I think I've heard you say life-saving medications.
Yes.
And when I think about that, and I think about the person walking in your door, they may have gone without those medications for a long period of time.
Yes, and I'm glad you brought that up, because we don't dispense any controlled substances from our pharmacy, but our patients primarily, the primary medications that we dispense are insulin, blood pressure medications, inhalers, or medications for asthmatics, those kinds of things that really are life-saving and quality of life improving. Those are really the goals that we have when it comes to serving our patients. So,
really, I think you both said it, life-changing for those patients.
Yes, and another huge thing that our team does and that our volunteers support is navigation of other community resources. So there are patients who come to us who aren't necessarily seeking medical care but could benefit from the services offered at Yokefellow. Or that they have medical needs that we can help to meet, but they also could use the services of a program like RHA. And then we also take on some of the responsibility to help these patients access other resources. Just like Anita was saying, we have patients that we assist with disability applications, that we assist with a Medicaid application if they become eligible while they're a patient of ours. We have patients that that graduate from us and are able to access Medicare. So helping folks make those transitions for the resources that they need is another huge part of what we do. So.
Such an important part of what you do, because a lot of times, especially coming from the government side, I see people fall through the cracks.
Yeah.
They make just a little bit too much money not to qualify for a government service.
Yes.
And when I say little, it may be $2 or $3 difference.
Yes.
But those are the people that you guys are reaching out to.
Yes, and that's really, Helping Hands was founded on the belief that the amount of money that you make should not affect whether or not you have access to quality health care. And so many of Helping Hands services are built around gaps in our specific community, just to make sure that if someone is falling through that crack, that we can be there to catch them. So.
Yeah.
Such an important role, and I realized that was a total rabbit trail, just so people see how my mind works. Sorry, viewers, because we're supposed to be talking about volunteers, so I'm going to transition back to volunteers now. Do you have a minimum number of hours volunteers should work for you to stay as an active volunteer, or?
We actually don't, but a lot of our volunteers, a lot of the tasks that our volunteers do are weekly, bi-weekly, monthly sort of thing. So that's kind of the thought process. So there's really a lot of flexibility around what someone might want or need, or the time that they have to offer can be used to Helping Hands, which is really, that's a great thing. And then we also have relationships with some groups, like the Lenore Service League sends volunteers every week to sit at our pharmacy window and help with dispensing medications. That's amazing. That's something that frees up our pharmacy manager to continue doing the things that she needs to do and make sure that our patients have a friendly face that's there for them when they're there to pick up their medications. But to answer that question, no. Our volunteers do so many different things at the clinic and help in many different ways, and we don't want to put any kind of hindrance on their ability to do that. So.
How many volunteers do you have right now?
Yeah. Well, last year we had 78 volunteers who served. We're still right around that number. I think that we brought 10 or 11 new volunteers on board last year, so we have some great people who have been with us for a while, some new folks who have come in, and our volunteers provided a little over 1,400 hours of service.
That's awesome.
At our organization, which is pretty amazing. So.
I'm thinking about this, and you can tell me no, because this is out of nowhere, but do you have projects that a group could come in and do?
We do. Actually, as we're approaching spring and summer, there are some projects. Primarily, we have a basement organization project that we just talked about today, something that we need done. And then we have a document destruction project where it's time to go through some of our old patient records that we no longer have to keep on hand and get those ready to be disposed of without violating anybody's privacy. So we have a couple of things like that going on. We have a couple of facility improvement projects that are things that would be more oriented to a group to be able to help complete. So those are the kinds of things that we have going on this summer that we're looking for groups to help us with.
So whether you're an individual and want to volunteer, or you have a group that maybe it's a one-time project, or maybe you become a support group, a long-time support.
Yes.
Civic club or youth group or beta club, whatever.
Yes. There are lots of different opportunities, and we are just so grateful for the folks that spend their time with us and that support our work, that support our patients, and allow us to do what we do and keep our costs down, because the clinic is 100% privately funded. We don't have, we don't accept any kind of payers, so truly we are supported and funded by this community. To be available to the folks who need us. So I think that's wonderful, and the volunteers are a huge part of that.
Awesome. Anita, is there anything you would like to add as a volunteer at Helping Hands about anything about Helping Hands?
Well, I'd just like to say that the staff is fabulous. They're friendly, they're helpful, they're always so appreciative of everything you do. And if someone is looking for a volunteer opportunity, I think they couldn't go anywhere better. It's, my schedule changes from time to time, and since I am the only one that does my job, I just usually send Wendy a text and say, I'm not going to be able to come such and such. And a couple of weeks ago, I forgot to tell her I was going to be in the Dominican Republic. And she sends me a text on Thursday morning, and she said, "You're not here, is everything okay?" And I went, "I'm in the Dominican Republic." So, they're looking out for us too. So it is like a family there. And I've enjoyed getting to know all of the staff, and in fact, one of the staff is one of my former students now, so Olivia, and so it's good to see her, and it just makes me feel good. I don't typically see patients because I'm usually there at 8 o'clock in the morning, and I go up to my little office and do my work and say hello and leave to go to Quest to work out. But it's just such a good feeling to know that you're helping someone that is trying to help themselves. Because I get frustrated with people that don't want to try to help themselves.
Yeah, that's it.
So that's I'm going to try and volunteer as long as I can.
Yeah.
So
Thank you for volunteering.
well, it's a pleasure.
Brittany, final words? What have I missed today?
I would just like for anyone in the community who has lost their insurance, who doesn't have access to insurance, who isn't eligible for any of the assistance programs through Medicare, Medicaid, anything that's available like that, to please remember us as a resource for your health care, because we are accepting new patients, and I just want to make sure that everyone knows that door is open, and that we hope that we can help if you find yourself in that circumstance, because that's what we're here for in this community.
Thank you both for joining me today, and thank you for the services you provide to Caldwell County.
Well, I would like to also add a thank you to our volunteers. I think I've said it once or twice during this, but I would like to say it again, because we truly couldn't support our mission. We couldn't do what we're there to do without them and without the time that they give to us. So incredibly grateful for that.
And thank you for watching Caldwell County Today.